difference between us and a ground unit, okay? On a ground unit, you get to a patient that's like having a lot of trouble breathing, but they're still conscious, okay? Paramedics can put down a breathing tube at the scene, but can a paramedic put a breathing tube down if somebody is semi-conscious? If they're still awake, but their airway, so they got a lot of blood in their airway, they've got problems breathing, but they're still conscious. You can't do anything about that as a paramedic, right? We can actually give them drugs and like what they call paralytic drugs to paralyze them, knock them out, and put a breathing tube down. So that's one big difference. Once we do that, we hook them up. We have an onboard ventilator. You can see that right there. That's actually our onboard ventilator. It's just like a hospital respirator. You hook it up, it actually gives them a volume of air. We can adjust how much air they get, how much oxygen they get, that kind of thing. Of course, that's our cardiac monitor defibrillator. We have that right there. When we get out of the scene, all we really need to do to take care of any patient is grab this red bag and grab that monitor. In this red bag, there's everything you need to take care of a patient. There's IV fluids, there's intubation equipment, there's medications to paralyze them, there's everything you need right in that bag right there. So it's pretty amazing. That's really all we need, this and this. This orange box right here is a drug box. It has additional medications. You'll have everything in there that the paramedics have on ground units in Alabama, but there's extra stuff in here too, like special cardiac medicines that paramedics on the ground don't carry. This is an IV pump right here. Some of our patients we get are transfers from one hospital to the other, and they're on certain IV medications that need an IV pump, like you'd see, you know, in a hospital, big IV pumps. That's 3 IV pumps in one, in that little tiny space right there. That's actually 3 different IVs can be run through that pump right there. That's our backup heart monitor right there. Back here, that's just extra stuff like our oxygen delivery system, bandaging materials, stuff like that. Most of what you see in here is exactly like you'd see in a rescue truck or an ambulance. With the exception, it's about 1/4 the size. I mean, if you think about working in here, the type of patients that we have in here, I mean, we can do things like interosseous infusions and all kinds of things. You have to do that in this little tiny space right here, and that's pretty challenging. That's probably the most challenging part of working this job, is doing everything we do in this small amount of space right here, because we try to do most everything en route to the hospital, because if we're wasting a lot of time sitting around, we're taking away the need of the helicopter, right? Because if we're going to stay there 20, 30 minutes playing in the field, and you've talked about load and goes, right? We're a load and go situation. I mean, basically what we do is get out there, assess the patient, load them, and start getting to the hospital, because otherwise you really didn't need a helicopter if we're going to stay there for 20, 30 minutes, you know. Doesn't make, except, you know, in the case of an extrication. We can't help an extrication. I don't know if Trent mentioned this, but when we get on the scene, actually the aircraft stays hot. The aircraft engines are always stay on, you know, because basically we have to be able to depart quickly. And number 2, we may be landed in the middle of Interstate 65 or 85, which we do all the time, blocking all the traffic, and what would happen if it didn't crank? And that'd be bad. You're sitting out there with a helicopter in the middle of I-85 and be a lot of ticked off state troopers. So they keep it running, and that way we can make a quick departure. The blades are safe when you're walking under here. I think, Trent, did you talk about slopes? Where's Trent?
No, not yet. I would like to discuss it.
Okay, I'm going to let Trent talk to you about slopes. Generally speaking, on level ground, with the blade at what's called flight idle, meaning it's at a stationary pitch and it's not really doing a lot of moving around and all that, you're fine to walk in and out here, you know, you don't have to duck down. It's kind of the instinct to duck, but, you know, you really don't have to. But slopes are a different thing. Notice this field does have an upslope over here. And there is a little bit of a terrain issue right here. But if you were, you know, having to move, if we were up on that slope anymore and you were having to load a patient, it could be a different story than level ground, okay? Again, another reason to always follow the crew and do what we say when you're underneath here.
We're out here where Rolling Hills Fire Department had a air evac class for the EMT students that they're training to be locally helping the community by responding to accidents involving crashes or whatever kind of hospice or any type of patient care that we need.